How to reduce cold in children? So cold is the most common complaint in all pediatric age groups, coming from 3 months to 5 years and above. So lot of parents bring their kids with the complaint of cold, especially in the sense like running nose is there and associated with cough, or they're actually not sleeping well, they're having a lot of running nose in the mornings especially, and they're breathing with mouth, and they're coughing a lot early in the mornings. So cold is the most common complaint, and we can tackle it with multiple ways based on the etiology. In the sense, what is the cause of cold, we need to find it out. Most commonly the cold will be because of any infection. First we need to see, is it because of any infection? Generally, if it is because of infection, it will be associated with fever. So if there is fever, cold followed by cough, then you need to visit your doctor. So you need to visit your doctor and see to that whether it is any just a simple viral cold, or is there any bacterial involvement also is there, so that your doctor will decide and prescribe you proper medications. And in case if your kid is having a lot of running nose continuously over a period of more than a week or 2 weeks, or especially if he is having a periodic cold, in the sense running nose is there especially when on the basis of season, or related to any food intake, or related to any exposure to external environment, then you need to think of any allergic etiology. In case if you feel like your kid is getting cold, especially without any other fever, and just by some food intake or some exposure to external environment, or in any particular season or a period of time, then you need to visit your pediatrician, especially an allergist. Okay, then you need to see, is there any allergic involvement is there in your kids complaints. Okay, then your doctor prescribes you medications, either short term or long term, then they'll give a trial based on the response, you can go ahead with that. And when you coming to home remedies, generally you can try, if there is no fever, you can always try home remedies for cold for your kids. So home remedies comes with generally steam inhalation. That's the most common thing, but try to avoid steam inhalation in less than 1 year or less than 2-year-old kids, because this is the most common cause for burns. Especially when you're giving steam inhalation to your kids, they may be naughty, or they don't know, they may touch it, or they may pull it towards their nose, and it may cause burns to their face or body. So try to avoid them, or in case if you're giving, give it for a short time and at a very safe distance. Okay, and again followed by that, nasal drops. Saline nasal drops are the most commonly used drops. There you can use saline nasal drops, 1 or 2 drops in each nostril, and followed by that you can buy a nasal aspirator which is available in the market. And if the nose of your kid is blocked, you feel like that, then you can use that aspirator, and is there any blocked mucus in the nose, you can take it out with that aspirator, and your kid will get a lot of relief. That is one thing. Third thing is, if the kid is having a lot of cold or cough, generally you can try, most of the parents try home remedies like honey. Yeah, you can go ahead with the honey and you can try, but not less than 2-year-old. Generally you can try it more than 2-year-old, that will be better. It coats the throat generally, and it gives a sort of relief, not completely, but a sort of relief. And vapor ups, many parents ask that, can I use vapor up to my kid, is it really helpful or is it really harmful? Generally yes, you can go ahead with the baby vapor ups which are available in the market, but don't apply them directly to their nose or chest, but rather you can apply them to their clothes, so that they'll breathe the flavor of that, and it gives them a relief, which because of the decongestion, and they will sleep happily, comfortably. Thank you.